Welcome to Health Hub Sweden. Today we're going to take a deep dive into the world of migraines and explore all its aspects, from causes to treatments and everything in between. Migraine is not just an ordinary headache. It is a complex neurological disease that affects millions of people worldwide, mainly women. The condition can be so debilitating that it interferes with everyday life and forces sufferers to stay in dark, quiet rooms for days. While society often underestimates migraines, intensive research is underway to understand its roots and find more effective treatments. What is migraine? Migraine is more than a regular headache. It is a chronic neurological disease that affects approximately 15% of the world's population. Migraines are characterized by recurrent, severe headache attacks that are often accompanied by nausea, sensitivity to sound and light, and in some cases an aura, a warning sign that may include visual disturbances or tingling. This disease affects women 3 times more often than men, which points to hormonal factors as a crucial part of the migraine cause. Each attack can vary in intensity and duration, making it a deeply personal and unpredictable disease. To understand migraine is to recognize its seriousness. While it may seem like a common headache to outsiders, migraines are a disabling, life-changing condition that requires careful management and treatment. Causes of migraine. The causes of migraine are many, which means that both genetic and environmental factors play a role. Genetic predisposition is strong, with research showing that if a parent suffers from migraines, the risk of the child also developing the condition increases significantly. Environmental factors such as stress, lack of sleep, certain food ingredients, such as MSG and red wine, and even weather changes can trigger migraines. Hormonal changes, especially those related to the menstrual cycle in women, are also significant triggers. By understanding these causes, individuals and caregivers can better anticipate and potentially avoid factors that lead to migraine attacks. It is a balancing act to identify personal triggers and create strategies to deal with them effectively. Mechanisms behind migraine. Migraine occurs as a result of complex neurological changes in the brain. These changes involve an increased activity of neurotransmitters, such as serotonin, which can affect both the central and peripheral nervous systems. This leads to what we experience as migraine pain. At the heart of migraine attacks is a process called cortical spreading depression, which is a wave of electrical activity that travels through the cerebral cortex. This wave can cause symptoms such as aura, which often precedes the headache itself. After this wave, a change occurs in the blood vessels in the brain, which leads to inflammation and further pain experiences. It is this series of changes that makes migraine a particularly difficult and unpleasant experience. Understanding these mechanisms is critical to developing effective treatment methods and to providing patients with relief from their symptoms. In order to make a correct diagnosis of migraine, it is crucial that doctors use both the patient's self-reported symptoms and a thorough medical examination. The diagnosis is often supported by criteria established by the International Headache Society, which includes specific symptoms and the nature and frequency of attacks. Patients are encouraged to keep detailed diaries of their headache attacks, including time, duration, intensity, possible triggers, and the effectiveness of pain relievers used. This information is invaluable in tailoring a treatment strategy that is effective for their specific migraine pattern. In some cases, additional neurological tests or imaging studies, such as MRI or CT scans, may be needed to rule out other causes of the symptoms. However, in most cases, the patient's detailed history and symptom description are crucial for the diagnosis. The treatment of migraine is multifaceted and includes both pharmacological and non-pharmacological methods. Medical treatment can range from over-the-counter pain relievers to specific migraine medications such as triptans, which are meant to be used at the first sign of an attack. In addition to medication, it is common to include strategies such as stress management, regular physical activity, and relaxation techniques such as yoga or meditation in the treatment plan. Acupuncture and biofeedback are also popular options that many patients find helpful. It is important that each patient receive a treatment plan that is tailored to them, as migraines vary greatly from person to person. What works for one individual may not be effective for another, making patient-caregiver collaboration essential. Preventing migraines often involves making specific lifestyle changes to reduce the frequency and severity of attacks. This can include anything from adjusting your diet, avoiding known trigger foods like chocolate or cheese, to maintaining a regular sleep schedule. Physical activity is also an important part of prevention strategies, as regular exercise can help reduce stress and promote better overall body function, potentially reducing the frequency of migraines. Stress management classes and techniques such as mindfulness can also be very helpful. Keeping a detailed diary of migraine attacks can also serve as a tool to identify specific patterns and triggers, which in turn can lead to more effective prevention strategies. By understanding what triggers one's migraines, one can better avoid those situations or factors. Women suffer from migraines 3 times more often than men, which makes it an important gynecological disease. This difference is often due to hormonal changes associated with the menstrual cycle, pregnancy, and menopause. Migraine attacks can often coincide with the menstrual cycle, a phenomenon known as menstrual migraine. This type of migraine can be particularly severe and long-lasting. Treatment strategies may include hormone therapy as well as standard migraine medications. It is important for women to discuss their migraine patterns in relation to their menstrual cycle with their healthcare provider to tailor treatment to their specific needs. Understanding and managing these hormonal triggers may be the key to effective treatment and relief. Research into migraine is ongoing, and new discoveries are made continuously. Recently, great progress has been made in genetic research, which has led to a better understanding of the genetic factors that contribute to the disease. One of the most promising areas is the development of CGRP antagonists, a new class of drugs specifically targeting a molecule that plays a central role in migraine attacks. These drugs have been shown to be effective in reducing the frequency and severity of migraines in many patients. In addition to medical research, techniques such as neurostimulation and lifestyle interventions are also being explored as potential treatment methods or adjuncts to existing treatment. These advances offer hope for better and more personalized treatment options in the future. Migraine is not just a disease in medical records. It is also a personal journey for millions of people. By sharing their stories, individuals living with migraines can provide insight and understanding into the true impact of the disease. One person described how migraine prevented them from participating in everyday activities and often led to isolation. However, through appropriate treatment and support from a migraine group, this individual was able to regain some of his former life and better manage his symptoms. Another story is about a young professional who learned to identify her migraine triggers and adjust her work schedule to reduce stress, which significantly reduced the frequency of her headache attacks. These stories highlight the importance of individual solutions and community support. Migraine is a complex and often misunderstood disease that requires attention, research, and compassion. By increasing awareness and understanding of migraine, we can improve the lives of those living with this difficult disease. It is crucial that migraine sufferers seek and receive proper diagnosis and treatment. Society and the healthcare system must also work to support research and develop new, more effective treatments. Remember that every step towards a better understanding of migraine is a step towards a healthier and more inclusive society. This deep dive into the world of migraine shows the need for continued research, better treatments, and above all, a more empathetic society. It is important to remember that this information is for your own knowledge only. If you suffer from migraines or any other health problem, always seek the advice of a specialist for individual treatment. Thank you for taking the time to explore this complex disease with us. You watched the Health Hub Sweden exploration of migraines. Don't forget to like and subscribe for more useful health and wellness information.